Away from the hospitals, but still on vaccines. Fresh details emerging. Review. The Ghana Airport Company Limited is allegedly being shortchanged by Frontiers Healthcare Services, which was contracted by government to conduct COVID-19 testing at the Kotoka International Airport. Documents cited by Joy News show the company agreed to pay Ghana Airport Company Limited $10 per test. But sources close to the company, Airport Company Limited, say they are only receiving $4. This, they say, violates the contract agreement. Before we get into that, Transport Minister Designate Kweku Asiamah told Parliament Appointments Committee yesterday the Frontier Healthcare Services was only granted space by the Ghana Airport Company to undertake its duties. He added that he is unable to say more about the testing carried out by the entity.
Ghana Airport Company wrote to PPA, and on 26th of August 2020, the headlines read re-approval to rent office space at Terminal 3-company to test for COVID-19. Mr. Chairman, the letter reads, we acknowledge the receipt of your letter reference GL 1256946 dated August 25th, 2020 on the above subject matter and have digested its contents. However, we advise that the rental of office space, and in this particular case, being rented out to another company falls outside the scope of the Public Procurement Act at 663 as amended. The Ghana Airport Company is therefore requested to use administrative procedures to execute this transaction. We count on your cooperation. The Managing Director, Ghana Airport Company Limited.
You are suggesting to this committee that the contract to which the deputy leader asked you, and you said, yes, you have cited it, the contract is about renting of office space and nothing more. Am I correct in suggesting that?
Yes, indeed, Mr. Chairman, that is so.
So what more do we know about this subject? My colleague Winston Amwa is joining me on the line with some details. Winston, what more can you tell us about this amount that was agreed upon between the airport company and Frontiers Healthcare Services?
Well, Gifty, so if you look at the fees as agreed by between the Ghana Airport Company Limited and Frontiers Healthcare Services, Frontiers is expected to pay the Ghana Airport Company Limited $10 per test conducted. Now, our source of the Ghana Airport Company Limited tells us that currently the Ghana Airport Company Limited is paid $4, Port Health is paid $3, and the Ghana Civil Aviation Authority also paid $3. And so the $10, as we see in the contract, that's paragraph 4.2 in the contract, all isn't going to the Ghana Airport Company Limited, but is also going to the Port Health as well as the Ghana Civil Aviation Authority.
Let's talk about the Food and Drugs Authority's role in this. Yesterday, we heard the minister say a little bit about it. Did they authorize the activities, or to what extent did they authorize the activities of the Frontiers Healthcare Service?
So according to a letter that I have seen from the Food and Drugs Authority on the 24th of August 2020, the Ghana Airport Company Limited wrote to the Food and Drugs Authority seeking authorization for the usage of some testing equipment. Were arriving in August. The Food and Drugs Authority actually says some equipment have been certified by the Food and Drugs Authority in pursuant to Section 118 of the Public Health Act 851. Now, it talks about a local agent, which is Healthcare Solutions Limited. Now, the Healthcare Solutions Services Limited is actually the company that owns Frontiers. Okay? So that company was incorporated on the 3rd of June 2020 and was certified by the Food and Drugs Authority on the 1st of July 2020 to use these equipments that a Ghana Airport Company was asking the Food and Drugs Authority to certify for the usage of testing for COVID-19 gifting.
Speaking of which and dates, Winston, we know that the contract was signed, according to the minister, on the 1st of September. But it also emerged yesterday that the operations of this company actually also started on the same day.
Yes, because we opened our airports to international travels on the 1st of September. And the contract which I have in front of me talks about an agreement between the Ghana Airports Company Limited and Frontiers Healthcare Service Limited for the provision of COVID-19 testing service at the Upper Arrival Terminal 3, Kotoka International Airport, and is dated 1st September 2020.
Let's talk a little bit about this very thorny issue about how much they were charging. Does the contract specify how much was supposed to be charged for the antigen testing?
I haven't seen that in the contract. Nowhere in the contract is it stated how much is expected to be charged. What I have seen in the contract is how much is expected to be given to the Ghana Airport Company Limited. What I have also seen in the contract is the rent charge of $153,000 to be paid the Ghana Airport Company Limited annually as rent charges for the usage of their facility for the testing services.
So it was solely about the renting of space for the testing. Does it say what time length given?
Well, so the contract is valid for 2 years. Starts from 1st September 2020 to 2022, Gifty.
Well, thank you very much, Winston, for that. Winston Amwa is my colleague there, taking us through the Frontiers Healthcare Services company's contract with the Ghana Airport Company Limited. The minority spokesperson on health, Kwabena Minta Akando, is joining us on the line right now. Ms. Akando, thank you for your time. Good evening. Can you speak up for me, sir?
Yeah, good evening. Can you hear me?
I do hear you. Thank you for your time. Were you satisfied, or may I ask, to what extent were you satisfied with the details provided by the Transport Minister designate when it comes to the Frontiers Healthcare Services contract? Indeed, he was one of the people that all the others who came said had the information we were asking for.
I think the man did more harm than good. I think he even worsened and created a lot of confusion around the whole issues. To start with, if you remember, and if you could even Google, we had a press conference on this particular issue as far back in October 2020, if you recall. And we raised legitimate issues in our press conference. And none of the issues that have been raised so far has been given any attention or any answer. Number one, what are some of the issues we were raising? And before I even go to the issues, you realize that all the cabinet ministers who have been reappointed, when they appeared before the appointment committee, it was becoming embarrassing because almost all of them didn't know anything about this particular contract. You know, the president had already announced that this particular fight against COVID-19 was going to be treated as multi-sectorial. And so it was not going to be only one ministry dealing with it. So one would expect that, look, if issues are taken at that level, or even if issues are taken at cabinet, any minister who is part of it must know at least something about that particular activity. But unfortunately, it turned out that a lot of them didn't know anything about this particular contract. Number two, when the minister designate for transport appeared before the appointment committee, what did he say? And what are the issues? Number one, we raised issues about whether or not they followed the legal processes in fixing fees. What is the fee? The fee or the charge was around $150 per test. Of course. Hello?
I'm here.
Okay. So we all know that in other jurisdictions, they are even charging the same antigen test. They are charging less than $150. Others are doing as low as $7 and $8. So the question is, what criteria arrived at that $150 per test? The minister responsible for designated responsible for transport couldn't answer that question. They were even asking him about the directors of the company. He says he cannot answer. They were asking, and he even drew our attention to one very serious issue, that a contract was signed on the 1st of September 2020. And it was that same day that the Kotoka International Airport was reopened, and a lot of issues. Even it came to light that they had no track record when it comes to issues of health.
But Mr. Kando, let me just jump in there a bit. Talking about the day they started work, we all know that we're dealing with an emergency. And this is something that all the ministers designates have said over and over again, that we were looking for solutions. This company approached this country and said, we have this solution to help you. You will go for it, won't you, in an emergency?
You see, I mean, there are a lot of issues. When they even closed down, they closed Kotoka International Airport around March, isn't it? Mm-hmm. So from March to September, you think that they couldn't have done anything about it. They should wait until the very day they were reopening the airport that they could go and sign contract. Look, what prevented government from buying the equipment for Noguchi to undertake this particular exercise? As far as testing is concerned, you and I know very well that when it comes to testing, the name that will ring a bell in your mind or in your head is Noguchi. You
spoke for the minority on health. Now, there was an issue about how much the Ghana Airport Company was taking. Apparently, the contract states $10, but the company was actually getting $4. Did you know about this, and what did you do?
Well, these are all issues we raised, and up to now, nobody is responding to those issues. And even at the appointment committee, you will recall that when they were even putting it to him, that as far as our information is concerned, it's about $4 or $5 was going to Ghana Airport Committee. He says, as far as it's concerned, per the document, it's $10 that he knows.
Okay.
He couldn't even answer that question, and I don't know if you followed the
conversation. Well, Mr. Kando, I say very big thanks to you for your time. I appreciate it. Mr. Kando there speaks for the minority on health in Parliament. Let's speak to an anti-graft campaigner, Vitus Azim. Ms. Azim, good evening and many thanks for your time. Why are you asking for the Frontiers Healthcare Services contract to be probed? Okay, Ms. Azim, I don't know if you can hear me. If you do, can you give us an answer? Looks like I'm having a bit of an issue there with